Thanks so much. All right. My name is Erwin. I'm from the Durban University of Technology, and I have the honor today of being the chair. But to start off, I'm going to hand you over to James because he is the person responsible for bringing us all together today. So James, over to you to do the welcome.
So thanks, Kira, and yes, welcome everyone on behalf of the School of Public Health and Family Medicine, and specifically the Division of Environmental Health. Public health is the science and art of preventing illness and promoting health and improving quality of life through organized effort and informed choices. And the role of the informal workers, and in this case, waste pickers and reclaimers, is a very significant one in the economy of South Africa. And yet it's a sector that has been particularly hard hit during the COVID pandemic, as we'll hear, with huge losses in the informal economy. And yet waste pickers and reclaimers in particular have a significant contribution to make to our economy. So it's my hope and the hope of those who have been part of the planning of this over several months that this webinar will really add to advocacy efforts amongst the public health sector to work towards greater gains for those in the informal sector and waste pickers and reclaimers in particular. And I'm delighted that our guests are able to join us from across the spectrum and to bring a very informed and interactive flavor to this webinar today. So with that, I wish you well and trust that all the technology behaves and that we'll be able to have a good discussion at the end. So thank you, Kira, and thank you to our guests today.
Thanks very much, James. So before we hand over to the speakers, I'm going to ask Musa Chamani. Many of you might know him. He is a waste campaigner at Groundwork, many years experience in this field, and also working very closely with SALPA to organize the waste picker sector. So Musa, just to give us a quick 3-minute context of what reclaimers and waste pickers had to deal with, particularly in the context of COVID. Over to you.
Good day, folks. My name is Braham. I work for Groundwork as a waste campaigner. Waste pickers are the people who are
Musa, sorry, I don't know what's happened, but your mic has been muted. Won't you just unmute it? Sorry.
Okay, I'm sorry. Good day, everyone. My name is Musa Kamane. I work as a waste campaigner at Groundwork. I normally work with waste pickers across the country, and the waste pickers are the people who are picking waste at landfill sites, on the streets, as well as in communities, and they exchange that waste material for a living. They sell each and every day in the afternoon or once a week, depending on the waste picker. So we've been in this struggle of fighting for waste picker recognition in this country since 2007. And in 2009, we had various meetings in provinces and we had national meeting. And waste pickers are now formally recognized by government and by industry. And for the first time, the Minister of COGTA declared waste pickers as essential workers during the times of COVID. And for the first time, the President did mention the name waste pickers. So that cemented the waste pickers recognition. And waste pickers are fighting for zero waste. They want to make sure that the recycling happens in this country. The only thing that we need to do as consumers is to make sure that we create an enabling environment for them to make this livelihood or to preserve these livelihoods. We've got about 60 to 90,000 waste pickers in South Africa, across all towns of South Africa, and they all fighting for the same thing, for livelihoods. So we just need to assist them that they get access to these livelihoods. At the same time, we should not forget about their health. And that is why we're having this webinar today, to make sure that waste pickers' health are also not forgotten. So I would like to stop there for now. Thanks.
Thanks, Musa. That's great. Okay, so we're going to move on to the panel of speakers. And I see Luyanda has just joined us. Welcome, Luyanda. Fantastic that you're here. Musa, I saw that Simon was on, but it looks like he's dropped off.
No, so, I'm on.
Are you on? Okay, fantastic.
Yeah.
Thanks, Simon. I couldn't see your name. I got a bit worried. All right, wonderful. So we have 3 speakers today, and I'm going to introduce all 3, and then we'll hand over in the same order. So the first speaker is Simon Mbata, and Simon is a national coordinator for the South African Waste Pickers Association. He's based at the Vol Park Recycling Centre in Sasolburg, and you can see Simon coming up on the screen now. Hi, Simon. Thanks so much for being here. And he has extensive experience in this area, also creating a zero waste program. So we're very lucky to have him with us. And then the second speaker is Hlatshwayo, and he is a reclaimer working in and around the city of Joburg. He's got 10 years experience in this area and is a founding member and organizer of the African Reclaimers Association. Luyanda, very nice to have you with us today. And then the final presentation is by Christy Braham. She is in the Workers' Health Coordinator for the Global Network of Women in Informal Economy, Globalizing and Organizing, better known to many of us as WeGo. She's also a public health researcher and activist. And alongside her role at WeGo, she is the founder and coordinator of the African Platform for Migration and Inclusion in Health. So I think you agree with me, 3 very exciting people to have with us today. So Simon, I'm going to hand over to you just for 10 minutes for your talk.
Thanks, Kira, and thanks to all the participants and also the panelists. And Kira, thanks also for the topic itself, because as waste pickers, the health element has been a challenge. I remember in the past, waste pickers were not allowed to enter the landfill because the health care sector was totally against waste pickers working at the landfill based on the environment that they were working on. But recently, there's been a lot of changes that we have seen in terms of policy towards the informal sector or the waste pickers in regards to waste management. And in most of our meetings, we've been calling for the healthcare sector to be part of these meetings because there are very important issues that needs to be dealt with in terms of the operation of waste pickers, as well as the integration, as well as implementation of zero waste programs. The point being, in the past, we were condemned based on the statement by the healthcare sector. But we are calling to say that because the waste management is changing, the healthcare sector should be part of the changes that we are adopting in the waste management department. The environmental department has played its role. We have laid down guidelines in terms of integrating waste pickers. But where is the health element of it? We are lacking the health sector in terms of educating our communities, because one of the challenges with our community members, we have medication at household level where people are using medication. When somebody passes away or whenever the medication gets expired, communities don't know how to deal with such medication in terms of disposing it. It ends in the waste stream, and tomorrow the waste sector will be condemning waste pickers to say that you are not supposed to be there because this and these materials land there. But it doesn't start there. It starts at the disposal point, how to dispose medical waste. We have seen in the past, the health sector was quiet during the listeriosis time, whereby we needed education within our communities to say that we acknowledge the role of waste pickers being there within the waste management sector, environmental affairs department has acknowledged and they have recognized the role of waste pickers within these the sector itself. It needs also the healthcare sector to acknowledge and see the role of waste pickers, so that when we go to communities, we raise awareness together and educate communities in terms of how to dispose waste. We have seen it through when listeriosis was spread, and it's COVID now. Nobody, the health sector has been quiet in terms of classification of these measures of prevention. We needed their voice as a healthcare sector. Another thing which is important is healthcare access to the communities of waste pickers, the most disadvantaged. We're dealing with a lot of infectious waste, and waste pickers have never been attended to. There hasn't been enough awareness towards our communities to say that how to classify medical waste at household level whereby we can dispose. I think going forward, we need the health sector in terms of building together awareness campaign. The top-down approach period has passed away, whereby they will end up pointing fingers to say you were not supposed to be there, but forgetting that hunger, poverty, unemployment has risen in the country. People have found alternatives to make a living. It's how to make it safe for the communities, how to take care of these communities, how to make sure that they have access to health care, because most of us are unemployed, most of us come from the poor households, most of us come from those disadvantaged communities. So the issue of healthcare is important because some policies are guided by the healthcare sector's comments, like in the past. So we are appealing to say to the healthcare sector, let's work together, building models of zero waste, where waste needs to be separated. Another challenge of hygienic waste is nappies. It's those kind of waste that communities at household level don't know how to deal with it. But working together with organization of waste pickers, other departments, it's now time for other departments to interact so that policy can be guided by all of us involvement. We don't want to left others behind. That is why we are calling to the healthcare sector to say that there's a system of zero waste that is being built across the world, and South Africa is leading in Africa in terms of building programs of zero waste. Let's join hands together to educate communities about how to separate their waste, how to handle medical waste at household level, how to deal with it in terms of disposal, so that the health of waste pickers is safe. Thanks.
Oh, Simon, thank you so much. I think a very clear statement there on why zero waste and inclusive zero waste that integrates waste pickers and reclaimers is a public health issue and one that should be taken seriously. Thank you so much. Musa, I see you have your hand up, but I'm going to open. Okay, it's down here. I'll open for questions after all three of the panelists have had a chance to speak, so we can definitely come back to that. Thank you so much, Simon. Luyanda, I would love to invite you in now, please, and we're looking forward to hearing from the perspectives of the reclaimers your views on the issue too. Welcome.
Thank you very much, Kira, for having me. My name is Hlatshwayo. I'm an organizer, as you said, and reclaimer in the city of Johannesburg for African Reclaimers Organization. I think I'll start with the findings that we had when COVID started. I think the first problem that we had was the problem of education on the virus itself, education on how how it's extended to the next person, education on how the longevity of it in the materials that we're collecting, in the plastic that we're collecting. The second thing I would like to highlight is that the first form of support that actually came in for reclaimers on the ground was from civil societies, who were able to provide that form of education and support and saying, and let's start talking to the informal sector because they're very vulnerable, and start supporting with the necessary things, with things like masks, sanitizers. It's a shame that our government hasn't recognized the value of the informal sector, especially on the recycling part of it, to the point that we have been vulnerable on the health part of it for such a long time. People start talking about masks right now. Reclaimers have been wearing masks way before people knew about COVID. We've been washing our hands way before COVID started. It's not something that is starting today. It's a problem now because it's affecting everyone. But it has been a problem for us for a very long time on handling of medical waste that people dispose, whether it could be at the landfills or in the bins. The disposals of things that are not safe for reclaimers. And I'm very happy that we are having this conversation, because it's about time that we start looking at the different aspects of support that reclaimers actually need. It may not be necessarily the financial support, but it's the support of keeping the work, keeping yourself safe, and keeping yourself clean whilst doing your work. Now, with the pandemic added on, it shows how vulnerable reclaimers are, because immediately when we started on COVID, there wasn't any possible ways of reclaimers to be able to start earning a living before we actually announced as essential services. But businesses were closed. We can be able to go and collect materials, but still you can't be able to sell materials. You have people that are on chronic medication. How do they drink their medication on a hungry stomach? You know, it opens up to many different aspects of how supporting the work that reclaimers are doing. On separating of materials, on separating of materials that are not safe for reclaimers. I think it's important to instill systems of separation of sources from household, as my colleague Simon has actually said. We need to start separating materials from source, because it becomes a problem when reclaimers need to start sorting it out, when reclaimers need to find ways of disposing it, when reclaimers find it at the landfills and there's nothing to be done with it. There's food waste that is going to landfills that's not supposed to be going to that, and it becomes toxic. So I think it's very important that we look at systems of how do we support reclaimers directly. We are going through a process now of everyone being vaccinated. Have we looked at how reclaimers will be vaccinated? Because they form a very huge part of the community. I strongly believe, yes, we are part of the community, but reclaimers need to be prioritized. We were prioritized, as we were saying, essential services when COVID started, but now we are not being looked at because we are still essential services. We need to be prioritized when it comes to vaccination of reclaimers, to testings of reclaimers, and to direct support on medical support on reclaimers. People travel a lot of kilometers on a daily basis. We need to be able to provide proper nutritious meals for people. People are not eating properly, and they're saving the communities and the industries millions of rands. And people, it's a shame the hard labor of people that goes into South Africa to be able to withstand and be the backbone of the recycling industry, and not having anyone worry about their health care. Thank you very much.
Leander, thank you so much. And I mean, you're just really powerful listening to both of you. And your point is noted around this lack of recognition by the state in many ways actually puts reclaimers at risk in ways that people don't even realize until the crisis hits, like COVID. So thank you, Leander. Please, we'll come back with questions. I'm going to go to the third speaker. Christy, lovely to have you here. Welcome, and please do go ahead.
Thank you, Kira. I'm just going to share my screen, or at least attempt to. Let me just do this. Can you see my screen at all?
Not yet. Not yet.
Okay.
You know how to do this in Teams?
No, I'm not normally.
Okay. No worry. Let me walk you through it. It's if you're normally Zooming, then it's a bit different. So if you have a look at the top right of your screen, you'll see that there's a little white button with an up arrow. If you click that, it will ask you whether you want to share your screen or a window, and then you can select the window that you want to share.
Okay.
Yes, we can see it. Yes,
we can see
brilliant.
it. Oh, fantastic. Okay.
Yep, you're good to go.
So sorry for that. Hi everyone. So tough act to follow. But my name is Christy, and I'm the Workers' Health Coordinator at WeGo. And what I really want to do with this short presentation is just give a flavour of the more global picture in terms of reclaimers, waste pickers, and public health during this crisis. And it's just kind of bouncing off what colleagues Simon and Leander said previously, specific to the South Africa context. So firstly, I just wanted to highlight some of the work that, some of the ongoing work that we're doing at WeGo. So waste pickers and reclaimers are one of the key groups of workers in the informal economy that we are engaging on. Other worker groups being home-based workers, domestic workers, and street vendors. And of course, colleagues are really hitting home this message of waste pickers and reclaimers being essential workers, who've been delivering this really essential life-saving even service during the pandemic, but also before the pandemic, and they will continue to do that after. And as a result of doing this work, reclaimers and waste pickers remain exposed in multiple ways, but it's still largely unprotected, and that's the real tragedy of this. So just to bring this in, so we've actually been running a two-part study on the impact of COVID-19 on various groups of workers in the informal economy, including waste pickers and reclaimers. And this study's taken place across 12 cities across the globe, and one of those cities was Durban, actually. And in Durban, we did a survey with almost 200 workers, including, of course, waste pickers and reclaimers. And we really wanted to get to grips with what the impact of this crisis had been on these workers during the first wave. So this is, we're talking between February and June, when COVID really begun. And to the right here, there's just a few screenshots of some of the outputs relevant to this discussion. So, we've produced various policy briefs talking about this situation in South African context, talking about it through the gendered lens as well, and also talking about it through a health lens. And we are continuing to bring these policy briefs out. And at the same time, we are getting started on the second round of this impact study with results from that due to come out later this year. And I just wanted to pick out a few bits of information from the study, a few results which talk about some of the impacts on reclaimers and waste pickers. So, we've heard about how waste pickers have been really affected by this crisis in multiple ways. So one of those is has been on livelihoods. Many waste pickers in Durban stopped working in April 2020, and have also some waste pickers have also experienced decreased hours, etc. and it's also led to decreased incomes. And this has actually impacted women disproportionately, especially because of increasing care loads as well, looking after children, looking after dependents, etc., etc. We've also found that waste pickers and reclaimers have been reporting, a lack of income support, and then actually this made them particularly vulnerable out of all the worker groups that were surveyed, and we think this is due to the fact that many of the workers, many of the reclaimers and waste pickers who were surveyed didn't necessarily have papers, so were undocumented in South Africa, which then affected their ability to actually to really get this income support. And of course, all of this means increased vulnerability in terms of livelihoods, and of course, if you're a migrant, that there are other health-related impacts there. So, that makes you vulnerable when it comes to accessing healthcare. If you need it in certain situations, because unfortunately in South Africa, a lack of formal papers does actually have an impact on that. There are other health risks that workers in Durban and globally reported. So these are both occupational health risks in terms of physical health and also mental health. Workers talking about anxiety, about obviously about the crisis, and about their livelihoods, and also other health risks due to contamination, handling contaminated materials, and also just fears around dealing with contaminated materials. And part of this health risk is also about not having the necessary protections, not having as much access to PPE. A colleague just mentioned about how reclaimers have long been using PPE, and that's absolutely true. But at the same time, many reclaimers, waste pickers, have been reporting to us about how they have had to fund it themselves. They haven't had as much help from the government in the South African context. And also some waste pickers and reclaimers also spoke to us about not having access to clean water. And all of this, does impact on the risks of, being exposed to COVID-19 and also other diseases. And that in and of itself can impact on people's ability to work. So I just wanted to basically flag a few other initiatives that we're involved in as we go in other parts of the world. So we've got this project, the Cuida project, which is based in Brazil. So we have colleagues in a city called Belo Horizonte in Brazil, and they are doing really, really fantastic long-term community-based work with several cooperatives in Brazil, cooperatives of waste pickers in Brazil. And this has been going on for multiple years. And this actually predates my time at WeGo. But essentially it has been about raising awareness of health risks faced by waste pickers, whether that's exposure to contaminants, chemicals, rodents, muscular pain, mental health, and it's really about awareness of health risks amongst workers, but also the wider public, and also health professionals as well. So it's threefold, I would say. But in the COVID context, this project has involved making recommendations for how to protect waste pickers in these cooperatives. So they've made posters which were designed for helping to educate waste pickers in terms of how long COVID can survive on different surfaces. So on the right, you can see a graphic there, obviously in Portuguese, which helps workers to know,
Oh, I think we might have just lost Christy. It looks like unfortunately, she looks like she's been kicked off. Oh, you're back.
Hi, sorry, I got a notification saying that I was removed from the meeting. I'm not sure what happened.
Oh gosh, no, I'm sorry. I don't know how that happened. We suddenly just saw you vanish.
No, it's like my internet wasn't affected. I just got removed for some reason.
Okay, no, sorry about that.
No,
Please
that's
do
fine.
continue, Christy. Yeah, you've got another 2 minutes left.
Okay, sure. I'm just going to reshare my.
Yes, please.
If I can. Can you see that?
Yes, we can.
Okay, fantastic. So I was talking about how we've had engagements between waste pickers and academic research as well, in terms of how we can actually help to educate waste pickers, but also the wider community on the risks that they face. And I've just thrown in these two other examples. So in Senegal, some of our team on the ground are working with an organization called Bokdiom, and they are based at Berber's landfill, which I believe is one of the biggest landfills in Africa, actually. And they've been sort of stepping in, filling stopgaps left by government, essentially, helping to support waste pickers with PPE, helping to manage temperature testing on site. And I wanted to throw in this example from Argentina. So this isn't actually specific to waste pickers and reclaimers, but it potentially will include them. Essentially, we've got comrades on the ground in Argentina who've been doing fantastic work engaging local governments on including and prioritizing workers in the vaccination process. And actually, in recent days, they've had some success. So they've been working with the city of Buenos Aires to help to register workers. So initially, it's going to be workers engaged in health points. So there are workers in the informal economy who are actually, helping with the COVID efforts, but they're also pushing for other groups of workers, including waste pickers and reclaimers. So that's one to watch in terms of the vaccination drive. Lessons for public health. So, as colleagues and comrades just alluded to, we really need inclusive public health strategies. We need, as health practitioners, researchers, policymakers, etc., we need to move away from this marginalization of waste pickers and reclaimers, not just in South Africa, but of course globally, because these issues are not unique to that context. We need waste pickers and reclaimers to be involved and included in testing, vaccination, etc., but also wider social protection initiatives. So cash grants and various other forms of social protection, sickness benefits, etc., that can also help to improve working conditions. Also supporting and resourcing mutual aid groups. So fantastic work from African reclaimers and also from groundwork, etc. They've been really doing some of the fantastic practical on the ground work where the government have failed. And we really need to get behind those initiatives and keep supporting them. And also, I wanted to say that this crisis, as much as it is a crisis, is also a moment of opportunity for us to really try and improve occupational health and safety for workers, including waste pickers and reclaimers, and really, make sure that they're included in these various frameworks. Beyond the COVID context. And so this is a real moment of opportunity where people are suddenly waking up to how important things like PPE are, and we need to capitalize on that. And there's just a quote there at the bottom right from our research, which is from a waste picker in Accra who makes this point about how we've really got to capitalize on this moment. And they say, COVID-19 has brought a lot of issues to waste pickers, but it also gives us other opportunities to improve on our health issue, COVID-19 has now given us that opportunity that now people are wearing the nose masks, they wear hand gloves and everything. We also have that opportunity to change those lifestyles that we have been living in the past. A few references, if anyone's interested in checking out some of our work, and there's our website. And if any of you would like to connect, there's my email address. Thank you very much.
Chrissy, thank you so much. Fantastic. And I think it's really useful to see the global context and also to see some of the projects that are happening in other places. So thanks. Fantastic. If I could ask Simon and Luyanda and Musa and James even possibly to turn on their videos, we're going to open up for questions and answers. And Christy, you can close your share screen.
Yeah, sorry, I was trying to figure out how to do that.
No problem. I also have to look at myself. That's always awkward. All right. Okay, thank you so much. I think this is a really good start to a conversation, and really the rest of the time we spend together is a conversation. So if you would like to raise your hand, if you're unsure how to do that on MS Teams, then it's at the top. You'll see there's a little smiley face with a hand, and underneath that you'll find your raise hand function. Or if you really can't find it, feel free to unmute. But Musa, I can see that your hand is raised. So would you like to go ahead?
Yeah, thank you, Kira, and thank you, James. I'm really happy that public health is really doing something for waste pickers, because the health issue has always been not being prioritized. Hopefully from now going forward, the health sector will work with us, not only in South Africa, even globally, to make sure that the health of the waste pickers are prioritized. And Christy, I was wondering in other countries whether, is there any country where waste pickers got an injection, got an approval to get COVID-19 injections? Because I know that there was that move to say it should be a struggle that we struggle for, to make sure that governments prioritize waste pickers injections when it comes to COVID-19. So is there any country that has approved such a thing? And secondly, in South Africa, I have tried to organize for waste pickers to get injections such as yellow fever, hepatitis, and all of that. I've approached the district health under the municipality. They are health district clinics. I tried to approach them to say we'll need them to provide clinic at least once a month at one landfill in Maritzburg. But that didn't work, and I thought they didn't even entertain it. I thought maybe my approach was not right, or I didn't speak the language that they would understand. So I'm not sure how to go about doing that, making sure that at least once a month a clinic will go to the landfill site anywhere in South Africa and provide what the waste pickers will need. Maybe somebody can advise us on that. How can we go about doing that? Or should we consult Department of Health nationally or provincially, and so on? So I would like to hear from you guys. Thank you.
Thanks, Musa. And thank you, Musa, for that question. Can I ask, I'm going to let Leslie ask a question. So we'll just take those two, and then I'll come back to the panel. It's okay. Leslie, I see your hand up. You want to go ahead?
Glad this panel happened. So the problems facing waste pickers is not dissimilar to the problems facing other workers in other informal sectors, and nobody wants to take responsibility for the informal sector, and I think that's the problem. So in a way, we need a model that provides care, occupational health services and other care for workers who fall outside the formal sector, because our formal sector is quite well regulated and employers pay for services and they're obliged to do it. But in the informal sector, nobody takes responsibility. So I'm just wondering if we could have some kind of pressure on the Department of Health to take responsibility, because they have environmental health practitioners who are supposed to do health work, but they don't see this as part of their job because there's no law that compels them to do it. So I think in a way it's a bigger problem of solving informal sector workers' health needs, occupational health needs, and it needs a sort of national policy. And I wonder if there's been any work with the National Institute for Occupational Health or the new NAPISA, the Public Health Institute, coming in with the Department of Health to get the Department of Health to try and solve this problem, because it's a big problem. Thank you.
Thanks, Leslie. Christy, would you like to respond? And then Simon, Luyanda, James, and Musa, you're welcome to come in too.
So I'm going to respond to the first question about waste. Have there been any successful, I suppose, initiatives of waste pickers in other contexts advocating for vaccination? So we've actually been monitoring this, and so far I haven't actually seen any formal inclusion of waste pickers in priority groups in any country, but in certain countries there has been a lot of attention paid to this issue. So it is becoming higher on the agenda. So in terms of specific context, I'm talking about like Vietnam and Philippines. And I think there's also several other countries in Southeast Asia. But essentially, they around sort of January, February, and March time, they really started to seriously consider, you know, how to include informal workers and which specific types of informal workers should be included. And in every vaccination, I suppose, schedule in every country, there are various stages. So, for example, you'll see that they almost always vaccinate elderly people first, or health workers, etc. And so there's in a way, it's a sort of hierarchy. And so when they have these discussions, they, they consider, should these workers be in sort of stage 2, stage 5, etc., etc. And what I've noticed in countries such as Cambodia, Philippines, and other countries in that region is that, they are raising the question of, waste pickers and reclaimers are doing really essential work. We should actually be vaccinating them alongside school teachers, etc., etc. So these conversations are happening, even though I haven't seen waste pickers specifically being successfully being prioritized. I think it's becoming a bigger issue, and there is a lot of advocacy happening on the ground. So I think we should definitely keep an eye on that. But I mean, for other groups of informal workers, they have had some success in that region. So I think we should cross our fingers on that at least.
Thanks, Christy. Anyone else like to jump in on the panel, and then I'll take another round of questions.
Thank you, Kira. I think very, very, very interesting points that she came in with. I think the first most important thing that we need to look at in South Africa is that there's lack of recognition for reclaimers in the entire industry. There's lack of recognition for reclaimers within government. It's a problem of policies. We saw during the support that the government was coming in with. It was, in my terms, very xenophobic, where only South Africans would be able to benefit certain type of support, where there's different types of people. There's people coming from Swaziland, people coming from Zimbabwe, people coming from Lesotho, who form part of this group of reclaimers. Now, the problem of policy is not only, I think, as I said, we need to include government at a higher level, because we as reclaimers feel that we are being sidelined and we are being separated. When you go to support the South African reclaimer with COVID-19 PPE, what are you saying about the other reclaimer? We all form part of reclaimers. I think the biggest concentration, as I said when I started, is that the first form of support that actually came in was from civil society. Civil societies have formed a very huge part of support for the informal sector, whether it be claimers or informal traders, where the government cannot be able to come in and be able to help. The support that needs to go through to these organizations is very important, because we started the education part of it. We started the thing of distributing sanitizers and distributing masks for as many reclaimers as possible. The support that the government needs to give first is to social to these organizations, because number one, it's difficult to find all reclaimers at one point. Now, what these organizations have done, organizations such as ARO and SALPA, have created one point of contact where government and reclaimer can be able to talk and can be able to engage. That platform of engagement is only happening at a very low level. It needs to be happening in a level where the policies can't be changed, so that there can be a proper change and a proper support at the bottom of the food chain.
Thanks, Leander. Thanks very much. Simon, I see you'd like to also respond.
Okay, Kira. Firstly, I think what is most important is the definition of waste within the public health sector. Because recently, waste is defined in a way that the public sector is left behind. The definition says now waste is a resource. But if you look in terms of the management of the health sector products, like medication that comes from the health sector, it's not well managed. I think the Department of Health should work closely with the Department of Waste Management in terms of policy making when it comes to waste management. That's something that is important. And I think also Leslie put it clear to say that there's a lot that needs to be done by both the departments. But the reality is that the department, the public health sector should learn what is happening in the waste stream, because not everything is waste. There is waste that is recyclable. And within their medication, the lessons that we have learned presently is that some of their medication is collected and being misused. That is why we are having boom drug trafficking in South Africa. It's because of the waste management system. The medication, some of it, people extract some of the things from them and it becomes drugs, and this becomes a threat to the society. Thanks.
Thanks, Simon. So, Musa, you asked a very complicated question, and I think it's one that we should really think about quite, a little bit more about what is the most strategic push and where in government for public health issues. But I'm going to let Laura come in because she's had her hand up for a while. So, Laura, if you'd like to ask your question, that'd be great.
Thanks, Kira. It might be more of a comment than a question. Just to say, my name is Laura Alphas and I work at WeGo with Christy. And it's just to re-emphasize, I guess it's related to Leslie's point, but also picks up on what Simon has just said, that I think the answer to occupational health and all informal workers is never going to just come from the Department of Health. It is going to have to be across departments, and that includes the Ministry of Labour, Department of Labour, Department of Health, and very importantly, municipalities. So we're talking about at national level here, engaging with COGTA as well. And I mean, that is what makes informal workers so different from many other workers, is that they're working in public spaces and often urban public spaces. And without the municipal buy-in, you're never going to get very far. And also just to say that I know that in South Africa at the moment, the ILO is running a small piece of work looking at developing guidelines on occupational health and safety for a few sectors in the informal economy, including waste pickers. And some of you may have been approached by them. There is a hope that that then feeds into a policy process around a more inclusive occupational health policy. So it is something to watch. And I think what's been impressive on the project so far has been their sort of focus on trying to engage with Department of Labour, Department of Health, and COGTA as well in the development of the guidelines. And I think that really is the way forward, these kind of multi-departmental initiatives. Thanks.
Thanks, Laura. That's really useful and encouraging to hear that. Thanks very much. Now, there's still 9 minutes left, so I'm happy to take a last pressing question to the panel. If anyone has something that they'd like to ask before we close off.
Well, thank you, everyone. I really appreciate those inputs. I guess as a member of the group going forward, we determined not to sort of let the matter lie here. And so, we will be continuing to meet to say how can we continue to support the advocacy efforts of reclaimers and waste pickers. I noted some of the suggestions around citizens who engage with waste pickers in their suburbs. I think, just from my perspective of living in a suburb in Cape Town, that there's a lot of ill feeling often towards waste pickers, so people need to be made aware of the contribution that waste pickers and reclaimers make to the economy. Just engage with them as people, offer them food and drink, separate your waste at source, as I think Simon said. And if you have a voice within the public health community, really use it to say, here are a group of workers who are very vulnerable. What can we do as active citizens to improve their lot in life? Thank you.
Thanks,
and any suggestions for the way forward are welcome.
Great. Musa, I think you have one last thing you'd like to say.
Yeah, thank you, Kira. For us, the focus has been mainly making sure that the waste pickers and reclaimers, they get recognition in the country. Honestly, I've never thought of the health of the waste pickers. To be honest, it never crossed my mind. So I think we've got a couple of health professionals here. They need to assist us to say, for people who are waste pickers, they will need number one, number two, number three. In terms of separation at source and all of those things, yes, that goes without saying. That is our main struggle. But when it comes to health, even officials from Department of Health and say, how can we help you? I would say, provide a clinic once a month to waste pickers across all landfills. And if he asked me what injections they should be given, I wouldn't know how to answer that question. But a health professional will understand that someone who works on waste, handling waste and all of that, these are the injections that are very important that he gets. So I'm hoping that the health professionals that are amongst us, they need to guide us on that, to say, while we're doing the advocacy that we are doing, and when we communicate with Department of Health, these are the things that we need to raise with them. So that assistance will be greatly appreciated. Thank you.
Thanks, Musa. I think that's a very important call, an invitation. Yes. Okay, so now hands are going up. I'm going to go Simon, Christy, and then Vanessa. I see your hand.
Thanks, Kira. Something when Musa was speaking came because when the pandemic starts, we engaged the Department of Environmental Affairs in terms of workers within the informal sector. And one challenge was to push for workers to be part of the essential workers. Then there came the vaccination. Through the Department of Environmental Affairs, they asked us to say, guys, as a department, we cannot authorize, but go through the Department of Health. I myself wrote a letter to the Department of Health to ask to say that as waste pickers are recognized now by the Department of Environmental Affairs as essential service workers, there is a need whenever vaccination comes, they should be considered. We never got a response. Thanks.
Thanks, Simon. That's disappointing to hear. Christy.
I just wanted to just sort of bounce off what everyone else was saying. You know, we're talking a lot about how us within public health, how we really need to engage in this issue, and I mentioned in my presentation, that we really need to be, obviously engaging in policy, but also continuing to support and show solidarity to organizations of waste pickers and reclaimers. So I'm going to put a link in the chat because on our WeGo website, we do have a page dedicated to ways in which all of us can support the initiatives of workers on the ground. And admittedly, it's not just waste pickers and reclaimers. We have included initiatives from other workers groups, but I do think that is a good starting point. And I think one of the things that we can do within this space that we've created today is to also assemble a collection of initiatives on the ground, including the work of African reclaimers, groundwork, SORPA, etc., so that people can be really made aware of the great work that you've all been doing through the pandemic, and so that we can spread the message within our respective circles, and continue to show solidarity.
Thanks, Christy. And Simpiwe, can I just ask that I can see for me the chat is disabled, but if Christy if you can put in the chat, that'd be great. Thank you. Vanessa.
Thank you, Kira, and thank you to everyone, to our very informative panelists. I just wanted to pick up on Musa's point around what interventions are possible in terms of mobile health services or mobile clinics, for example. And if there is somebody from the National Institute of Occupational Health on this webinar, if they could maybe respond, because a few years ago, about 2 or 3 years ago, there was an initiative by the city of Joburg, by Pick It Up, the waste management services, to do a study about the needs of waste pickers. And I know that the NIOH was conducting the study, and one of the early recommendations that were coming forward was exactly this, the provision of mobile clinics. But that, I don't know what happened to that project. So in as much as we are calling for collaboration and synthesis across national government, I think the same holds true at local government level, because we often find that we engage with municipalities and the one department inside the municipality doesn't know what the other one is doing, and it needs an integrated approach if you're going to deal with workers working in public spaces who need access to good public services. But I really want to invite, if there's someone from NIOH on this webinar, if they could maybe respond to what happened to that work that started in Johannesburg a few years ago. Thank you.
Thanks, Vanessa. We have a minute left, but I'm not sure, James, you might know better than I if any of the participants here might be able to respond to that, or even have a background in occupational health. You're not sure, you're muted.
Sorry, I don't know everyone in the webinar. So if anyone wants to admit to being part of the NIOH, please let us know, or if you can direct us to a contact there, that would be very welcome as well.
So if I can just say, I'm not from NIH, I'm from UCT, but I do know the NIH colleagues, and I can put people in touch. I'm sure you know Muzi Zungu and Sophie Keesting and others. So I'm happy to try and facilitate the ongoing discussion. So Leslie.
Thanks, Leslie. That's great. I'm sure many of us have your email, so that would be very useful. Appreciate it. All right, everyone, it is exactly 1 o'clock, and so we will keep to time. But just to say thank you so much for being here, and thank you so much to the panelists, Leander, to Christy, to Simon, to Musa, and to James for organizing, because it's clearly an issue that needs urgent attention. And as we start making sure it gets some more public attention, there's no pressure for government to move in this way. So thank you very much, everyone. Lovely to
Thank
see
you, Kira.
Only a pleasure.
Yeah.
Take care, everyone.
Bye-bye.
Bye. Cheers.
Thank you. Bye.
Bye, Christy.
Thanks, Christy.
Thank you very much.
We'll be in touch about a follow-up.
Definitely.
Appreciate it.
Thank you. Have a good rest of the day.
You too.
Bye.
Bye.
Thanks, everybody.
Cheers, Rico.
Bye, everyone.
Bye. Cheers, Vanessa.